Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Quaker Drive, Suite 4250, Chicago, Illinois, 60606. On WVON 1690 AM, The Talk of Chicago. I am Vietnam veteran host Cliff Kelley. America's Heroes Group is a live streaming podcast, global platform, radio, print, and digital media broadcast show that empowers change agents through intentionally disseminating information, resources, and referrals to empower our military population.
Thanks, Cliff, and welcome to America's Heroes Group with our roundtable with our partner, the Hines VA's Women's Health Clinic. Today is Saturday, February 18, 2023. February is Black History and American Heart Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our panelist with us, Dr. Caroline Ball. She's an assistant professor of cardiology at Loyola University Medical Center and the director of the Hines VA's Women's Heart Program. And some other things I want to mention about Dr. Caroline Ball. She graduated with honors and distinction with research from Loyola University Chicago Stritch School of Medicine. She did her residency with internal medicine at the Mayo Clinic, and she completed her fellowship in cardiology at Loyola University Chicago, where she now works. Dr. Ball conducts research on women's heart health. How you doing?
Wonderful. I'm so excited to be here.
I'm really excited for you to be here, too, because it is American Heart Month, and we wanted to make this show important, particularly when it pertains to women veterans. So tell me what is different or unique about women's veterans' health, particularly when it comes to cardiovascular health? How is it different from men?
Oh, that's a great question. You know, heart disease is the number one killer of women in the United States. There's this big misconception that it's breast cancer, but at the end of the day, more American women will die from cardiovascular disease than from all types of cancers combined. And this is particularly true for our veterans population. When I think about the cardiovascular needs of women in particular, I really split it into a couple of different categories. One is that women go through pregnancy, and pregnancy is really the first stress test on the heart. So as several of our veteran patients come back and go through pregnancy, it's really my privilege to help care for their cardiovascular needs throughout their pregnancy, whether that's because of heart disease going into pregnancy or heart disease that we discover during the pregnancy itself. I also think about some of the particular diseases that can affect women more than men when it comes to the heart. And then finally, as women go through menopause, we see that they have a number of changes to their cardiac physiology. So we see blood pressure issues that might not have been present when they were younger. And we can also see a particular type of heart failure called heart failure with preserved ejection fraction, which we tend to see in some of our older women patients.
I'm glad you brought that up about pregnancies, because doing research on this, I was very shocked and surprised to learn some of the things that go on with women's health, particularly with veterans. So what are APOs when we're talking about women's pregnancy?
APOs.
So when we talk about APOs, we're talking about, make sure I have this, understand this. So adverse pregnancy
outcomes. Yeah. This is a tremendous problem in the United States. We actually have a higher morbidity and mortality related to pregnancy than many other developed nations. And it's due to a variety of factors. One of the things that we're seeing is that as women have their first pregnancy later and later in life, many of them will actually go into pregnancy with cardiovascular disease that they may not have had if they had had their pregnancy at a younger age. This means that we have to manage blood pressure. We have to manage cholesterol issues. And we also know that we need women to be their own advocates because there are cardiovascular problems that can come up during pregnancy. And sometimes there's this thought that women can't get cardiovascular disease, or young, healthy women can't get cardiovascular disease. And it's important that women bring their symptoms up to their healthcare providers.
Wow. So tell us, what are some of the different types of heart disease that affect women? And is there anything, I want to add to this, though, is there anything unique to veterans?
Yeah. So there's a lot of conditions that we see more commonly in women than in men. A few of the ones that I think about, one is something called SCAD, or spontaneous coronary artery dissection. And this is when we see heart attacks in young, healthy women due to the blood vessel itself dissecting. So usually with a heart attack, there's a cholesterol plaque that ruptures and that blocks blood flow in the artery. In this condition, the blood vessel itself dissects, and we tend to see it in young, otherwise healthy women.
Wow.
Some of the other conditions, I know it's kind of scary, and we definitely see it in the veteran population. And that's, again, why it's important, especially when we think about veterans, these patients who are often in really great physical shape, to suddenly develop cardiovascular symptoms. It's important they speak up because they are at risk for having some type of heart disease beyond the traditional things that we think about. Other conditions that we think of in the sphere of women's cardiovascular disease, women tend to have blockages in the smaller arteries around the heart. So we often think about heart attack in the widowmaker, or the left anterior descending, that big artery that runs down the front of the heart. But you can also develop plaque and blockages in these really small capillaries that lead and kind of feed the smaller parts of the heart muscle. This can be much harder to diagnose, but it can still cause the same symptoms of chest pain and shortness of breath that you typically think of with cardiovascular disease. And so what this means is that just because you've been told, oh, your angiogram was normal, doesn't mean that there couldn't be some degree of blockage that could be causing your symptoms, doesn't mean that your symptoms aren't real, and doesn't mean that you don't need treatment for things like high cholesterol and blood pressure and all of that.
Let me ask you this, based on what you just mentioned, because I've heard of this and read about this also. So the tiny blood vessels that they can have problems. Is there any greater risk or less risk than those major arteries you mentioned? as far as
That's
death?
a great question. It kind of depends on which of the big arteries are involved. When we think about sudden cardiac death, what happens in the movies, the big blockage in the artery and the and the rhythm, the rhythm issues that come with that. That's often the epicardial disease. But when you think about life patients, right? The patient who used to be able to run up the stairs and now has to go up them slowly one at a time. You can have the same degree of lifestyle limitation with blockages in those big arteries that you do in the small. And the other thing to think about is whenever you're developing plaque and blockage in one vascular bed, that means that you can develop plaque and blockage in other vascular beds. So that tells me that if you have plaque in these small vessels around the heart, you may also have plaque in the blood vessels that lead to the brain. And all of these we can treat with a great class of medications. We just have to know that it's there and know that the symptoms are there.
So what are the risk factors that are unique to women?
Ooh, that's a great question. There's several. So just like in traditional cardiovascular disease, things like smoking is the number one risk factor for cardiovascular disease. If there were one thing that a veteran can do for their health, quitting smoking is it. Other risk factors are high blood pressure and high cholesterol. In women specifically, adverse outcomes from their pregnancy, so things like preeclampsia, gestational diabetes, actually increase your risk of cardiovascular disease down the road. It's something people think like, oh, it resolved, my pregnancy resolved, and I'm fine, but actually you carry some risk with you as you go forward in life. And then other things is sometimes treatment for other disease processes can lead to an increased risk of cardiovascular disease down the road. The condition I think about most is breast cancer. So women who receive certain types of chemotherapy for breast cancer are at risk for heart attack and for heart failure down the road. And women who receive radiation, particularly radiation to the left breast, because that sits right in front of the heart, are also at increased risk for heart attack and heart failure. And we're talking, 5, 10, 20 years later.
Wow. So what are some of the things that people can do, particularly veterans, to try to diagnose and get ahead of this so that it doesn't catch them at the wrong time when they're least likely to be able to overcome it or to have a bad outcome?
Yeah. So again, the number one thing is to quit smoking. If there were one thing you were going to do for your health, quitting smoking is it. But it's also important that you have a primary care doctor and that you're checking your blood pressure and your cholesterol regularly. I tell my patients it's helpful to have a blood pressure cuff at home and check your blood pressure once or twice a week. Also, knowing what your cholesterol is can help you identify if you need to be taking medication to help lower your risk for heart disease.
So people that are in the military, particularly people that are active after the military, they do a lot of exercise and things like that, might have low blood pressure or normal blood pressure, or they might not have high cholesterol. But they can still be at risk, you mentioned, for these heart disease. How do you diagnose or find out if you are in that category?
Yeah. So we have some risk calculators we can use where we take information about your cholesterol and about your blood pressure. But I often tell patients that exercise is one of the best ways to identify if you are at risk for cardiovascular disease. Because in many ways, when you're doing a regular exercise routine, that's just like doing a regular stress test. So when you find that you can't do the same things that you could have, a couple weeks or months prior, that tells me that something has changed and we need to take another look.
Wow, that's actually a very powerful point, because that we see that often as we get older, but we don't think about it or attribute it to maybe we think, oh, we're getting older, things like that, but we don't think, oh, our heart is also getting older and our heart might also need to be looked at. So what should women be doing to look at and prevent heart disease and stroke? What are some of the things that we talk about, preventive and maintenance? What are some of the most important things that women veterans particularly should be doing right now that you would say to all the women out there listening?
Yeah. Well, I would say exercise is really, really important, just like we were talking about, because it kind of has a diagnostic and a preventive factor. One of the challenges we have here in Chicago is that it's really only nice to exercise like 2 months a year outside. So it's important that people find a good exercise routine that they can do all year round. That means something that's safe, that they don't have to worry about the ice and snow. And I encourage people to look at the resources we have here at the VA. I know here at Hines we have a fantastic MOVE program that can help people stay active. And our social workers actually also have a great group of resources to use as far as, how to take advantage of your health benefits and make sure you're getting some insurances will cover access to gym. And sometimes there are things that we can offer through the VA.
So,
no, go ahead.
No, go ahead. I wanted to hear your last thought.
The other thing is, if you haven't done it in a while, now is a great time to go see a primary care doctor and get your cholesterol checked. Know what your risk is.
Now, we didn't talk about diet yet. Is the Mediterranean diet still the best diet for heart health?
So Mediterranean probably has the best data behind it. I like to tell patients it's all about moderation. Right? If I told you to give up ice cream for the rest of your life, for most of us, that's not sustainable. It's about finding moderation. But also, focusing on fiber can be one of the best ways to help control blood pressure, cholesterol, and maintain a healthy weight. So we know that when you focus on fiber, all the nutrition follows. And we also know that high fiber diets can be associated with lower total cholesterol.
Now, is this a myth that drinking a glass of wine a day, red wine a day, is good for your heart?
We don't prescribe alcohol for cardiovascular disease. There are some cardioprotective benefits of alcohol, but it really needs to be taken in context of the rest of the patient, right? Because alcohol can interact with some medications, particularly medications that cardiovascular disease patients may be prescribed, like blood thinners. And we also know that alcohol has some risks in other disease processes. But there may be some protective benefits to no more than 1 glass a day for women and 2 for men.
So another thing, people sometimes come see a cardiologist, and the cardiologist gives them a medication and say, you need to take this and this, but the person maybe doesn't want to take the medication or doesn't take it regularly. Are there other things that they can do? They might say, I want to see if I can lose some weight, or I'm going to see if I can exercise more. Is that advisable, or is that a realistic plan for someone who doesn't like to take medication?
Well, I understand not liking to take medication. There was actually this fascinating paper in the Journal of the American College of Cardiology a couple months ago that looked at some common supplements that use the claim, we help lower cholesterol. Specifically, they looked at things like garlic, turmeric, red yeast rice, and plant sterols. And what they found is that none of those are even close to as effective as using a very low dose of a cholesterol medicine. And they found that they were no better than a placebo. So that tells me that a lot of these natural or kind of products that may be marketed as healthy for the heart don't necessarily have the same benefits as the drugs that we prescribe. I think it's really important that you have an open discussion with your physician. If you say, listen, I don't want to take medication and I really want to minimize how many pills I take, having that open and honest conversation will allow the physician to say, okay, this is what's the most important for you, and help you understand the risks of not taking medication when it is prescribed.
Another thing that seems to be popular nowadays, talking about heart monitors when people are diagnosed with certain types of arrhythmias and things like that. How has the technology improved with heart monitors?
Some of those monitors are actually really good. You think about like the Apple Watch, which can help detect atrial fibrillation. And I actually recommend the Cardia monitor for some of my patients. This is another device that can detect atrial fibrillation. They're not perfect, and sometimes they can actually provoke more anxiety than things that they prevent, just because having your watch tell you that your heart rate is too high is not going to help you feel any more calm. But they are quite accurate.
Now, this is something that I want to make this program about breaking stereotypes and getting into the facts and kind of debunking some of the myths out there. People believe that this is a myth, that there's no such thing as dying from a broken heart. Is that, you're a researcher and you know better than anybody else, is that a real thing?
So there is a condition, dying of a broken heart. There's a condition called a stress cardiomyopathy, sometimes also called a Takotsubo cardiomyopathy. And what this is a basically the heart is put under a significant amount of stress, and it causes the pump to be a lot less effective. And in some patients, that can result in a heart failure to the extent of death.
Wow. So someone who has PTSD or suffered from mental sexual trauma in the military, could that put them in that risk category if they have depression and things like that, or anxiety, things like that?
Yeah, there's a lot of overlap between cardiovascular health and mental health. A lot of times these long-term chronic stressors are associated with other types of cardiovascular disease. We see increased risk of heart failure and coronary disease in patients who have a history of depression and anxiety and even PTSD. In general, the chronic, longer exposure to stress doesn't necessarily cause this stress cardiomyopathy. Usually a stress cardiomyopathy is in response to an acute stressor, so something short and quick. A spouse dies, or they've been put through a significant illness that can also cause an associated heart failure.
So how big of an impact does stress play in heart health?
Oh, a lot. We know that stress can cause inflammation, and inflammation can cause coronary disease. So chronic exposure to stress increases your risk for cardiovascular disease. Can also lead to increased rates of high blood pressure.
So you do research, and that's one of the things I really like about you being on the show today, is because you're a researcher and you're a doctor doing so you kind of see what's on the cutting edge right now as far as heart health. What's some of the new technology and treatments that are being developed today that might have us have a different conversation 5-10 years down the road?
Mm-hmm. So one is detection. The way that we can detect cardiovascular disease has evolved significantly. We think about how we can actually look at the arteries around the heart. 50 years ago, we didn't have all of the non-invasive tools that we have now. We can actually use CT scans now to take a picture of a moving heart. This is great. It allows us to see if there's blockages in the major arteries around the heart without having to do an angiogram. And we actually offer that service at Hines VA. It's a kind of a non-invasive way to diagnose coronary disease. We're also finding that some of the medications that have been around for a long time really do a fantastic job of lowering cholesterol. And we're finding that there are some newer medications out there that can do an even better job of lowering cholesterol. We frequently talk about the statins, which are cholesterol-lowering medication. We have some newer medications out there that are injectable that you may only have to use twice a year. Imagine you go to see your cardiologist twice a year, you get an injection each time, and that takes care of your cholesterol.
That would be awesome. I'm waiting for that.
Yeah.
You have to make sure that actually comes out. Dr. Kelley Ball, she is wonderful and telling us some great information. She is the Assistant Professor of Cardiology at Loyola University and Medical Center and the Director of the Hines VA Women's Heart Program. Thanks for coming on our show.
Oh, you're very welcome. Thanks for having me.
Got to come back.
All right, will do. Take care.
This is America's Heroes Group. We'll be right back.
Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-888-8255. 804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Wecker Drive, Suite 4250, Chicago, Illinois, 60606.
Welcome back to America's Heroes Group, our community roundtable outreach with our partner, AIDPH, which is the American Institute of Dental Public Health. Today is Saturday, February 18th, 2023. February is Black History and American Heart Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith. Our digital media producer is Ivan Ortega. Scott's on the productions and in charge of all things technical here, keeping us running smooth. We have our partner on the line. That is Dr. Annaliese Cothron. She is the co-founder and the executive director of the American Institute of Dental Public Health. She manages the program of fund development and the overall strategy of the AIDPH. We're talking about updates and new things going on with the AIDPH, and also the 2023 Washington, D.C. March is going to be on March 27th to 28th, called Hill Day. How you doing?
Hi, Sean. Good to be here again. How are you doing?
My pleasure. So pleasure's all mine. Great to see you again. So tell us what's going on the 27th of March. And what is Hill Day all about? I know you mentioned it a little bit before, but now I know you got some more details and things you want to talk about it. So tell us what's going on.
That's right. Well, as you alluded to, AIDPH and our oral health and veteran partners are heading to the Capitol for a day of education and advocacy around veteran dental care. And we've talked about this many times throughout the show, but, in case this is your first time channeling in today, or maybe this is a new topic for you, the reason why we are going to the Hill and we are pushing advocacy for expanded access to dental care for veterans is because 85% of veterans don't have access to dental care through the VA. So that's millions of veterans who are currently getting their medical care through the VA aren't eligible for dental care through the VA because of very strict criteria that's set in the federal code. So the federal code defines who is able to get benefits and how they are able to get them in terms of access within the VA. And right now, the federal code states that basically only veterans who are rated at 100% disabled through their benefits are able to access dental care. that leaves about 15% of veterans who are eligible through the federal code for dental care. And we here at AIDPH and all of our partners at the National Rural Health Association, at CareQuest Institute for Oral Health, at Veterans of Foreign Wars and Disabled American Veterans and Paralyzed Veterans of America, Minority Veterans of America, we just don't think that's okay. And we're here to help lawmakers really understand the impact that not having access to dental care has had so far on veterans, and really present them with some good information about how we can be saving money by actually expanding access to dental care. And so we're coming to the Capitol with 3 asks in mind in the hopes that we can stimulate some policy action.
Now, you mentioned before in other shows that a lot of people, even who qualify for dental health care through disability, don't use it.
Yes. So of that 15% that are eligible, of that tiny slice that are eligible, we know that only about 30% utilize that care. And I don't have a clear answer as to why that's happening, but there's probably a few different reasons why. Number one, we need to expand the infrastructure of the VA to be able to give every eligible veteran the convenient and affordable care that they are eligible for. And, I think also, too, there's really long wait times because we just need to expand our infrastructure. But the piece that I really like when we're talking about the expansion of dental care within the VA is if you expand the eligibility and you expand the coverage, and if you don't have a VA location close to you to receive dental care, you can actually go into the community and get care that you need. So you're able to get the care coverage through expanded access within the VA. And then as the VA continues to expand its infrastructure and strengthen the ability to expand the workforce and provide care within the VA, until that point, you're able to get care through the community in a convenient and close location to you that's covered, financially through the VA.
Do you think people, particularly veterans, have a clear picture as how important dental health is to their overall health?
I do think so. I truly believe that veterans desire good dental care, and I think that they understand the importance of dental care. And in fact, I've gotten comments before from a variety of entities who've asked that question and just say, well, maybe it's just veterans. Maybe they don't get it. Maybe they don't care. And what I like to remind everybody is every veteran has a mouth. It doesn't matter how you vote. It doesn't matter where you live. Every single veteran has a mouth. And our survey research that we've conducted throughout 2021 and 2022 very clearly indicates that veterans are aware that poor oral health impacts their overall health. In fact, veterans, when we ask them to rate their dental health versus their mental health and their physical health, they've rated dental health the lowest out of all 3 of those categories, meaning that they understand that the lack of dental care is actually manifesting in these really poor outcomes. The things that I've heard from veterans are, I'm struggling to get a job. I'm struggling to stay employed. I feel self-conscious of my smile. I actually don't go out with friends the way I want to because I feel like the state of my mouth and teeth is just so embarrassing that I'm not able to achieve all the things that I want to achieve in my life socially and financially. And so what we also see here is not just the self-awareness, but this unintended ripple effect of not having the dental care that they need. We're talking about economic ripples. We're talking about social ripples, mental health ripples. If you're not able to interact with people at your job or your friends or your family, or you feel embarrassed or self-conscious, that really has an impact on your whole person, right? And so that's why we're going to the Capitol to help educate policymakers on the value of expanding dental care, on the cost savings of expanding dental care. And we need everybody listening to help us tell that story. The 3 policy asks that we've crafted in collaboration with our veteran service organization partners and our other oral health stakeholders has been pretty clear. So number 1, we're asking for expanded dental care for everybody who's currently getting Medicare or medical care. And again, remembering that even if it takes time to build out the VA infrastructure, having the coverage of care means that if you don't have a VA dental location close to you, you can still access affordable care in the community. And we think that's important. And so that's number one. We believe that all 9 million veterans who are currently enrollees at the Veteran Health Administration should have access to dental care. Number two, we are asking that veterans with heart disease and diabetes be prioritized in a dental care expansion. And we're asking that for a few different reasons. Number one, our research, which you can find at AIDPH.org. There's a tab right under research called Veterans. It's pretty easy to find, and you can see exactly what I'm talking about, how we've been able to quantify this. We know that veterans with heart disease and diabetes have more complications when it comes to their oral health. And actually, it's the other way around, too. If you have poor oral health, you're more likely to have heart disease and diabetes. Those chronic disease conditions can be exacerbated by poor oral health. So it's this bi-directional relationship between oral health and those chronic disease conditions. And what happens is if you can give oral health care to veterans with diabetes and heart disease, you actually save money on medical care because both conditions are managed better with oral health care. And you're also, importantly, getting veterans who are high risk into a more routine dental care environment where you can avoid things like infections or dental pain that winds up taking you to the emergency room. On average, going to the emergency room for dental pain or an infection costs about $1,500 a visit. And sometimes that's coming out of taxpayers' pockets. Wow. Because it's an emergency medical cost. So if we're talking about spending money versus on emergency dental care, that's probably not going to solve the problem. Or spending money on prevention, I know where my tax dollars should go. So that's really the focus of our second ask is investing in prevention for veterans with heart disease and diabetes so that we can really get those folks the care that they need. And then lastly, we're asking Congress for, a true study of looking at the cost savings, right? Like we've done our research, we feel very confident in it, but we feel like Congress needs to take a holistic look at how providing dental care for veterans could save taxpayer dollars, improve health outcomes, and ultimately create a better healthcare environment all the way around for veterans. We keep mentioning that the VA expansion is important because the VA is the largest integrated health system in the nation. So, we have 9 million enrollees that are all connected to the same record and get treatment planning from all the same people in concert with each other. So I can go see a medical care provider. I can go down the hall and see a dental provider. I can go down the hall and see a physical therapist. I can go down the hall and see perhaps my therapist for mental health. And because everybody can design care together to give the veteran the best holistic health care, that's why we're really saying the VA is the best position in terms of expanding dental care to give dental care. So all of those things are considered together as a veteran goes into a medical appointment or a dental appointment. But also we want to ensure that that high level of care in a holistic setting, because of the VA, it's actually best positioned for cost savings. We're talking about those chronic disease conditions that are exacerbated by poor oral health and vice versa. The VA is actually the perfect place to set up to get the highest level of cost savings and save those taxpayer dollars.
Now, how is that? Explain a little bit more clear. How is the VA in the best position is to see the cost savings?
Yeah, so because of that connection between some of these chronic disease conditions and where we have our evidence at the highest is heart disease and diabetes, but there are also some emerging evidence around dementia and stroke and other chronic disease or disease conditions that we know either exacerbate poor oral health or can be caused even through poor oral health. And so there was a study done by Cigna Healthcare, and I believe it's in 2016, that really calculated the cost of having to provide additional care for those chronic disease conditions. And because those chronic disease conditions cause gum disease and inflammation, treating that gum disease actually reduced whole person inflammation throughout your entire body. And that meant that your chronic disease conditions were actually better outcomes. So through those medical care savings, by providing effective dental care access, that's where the true cost savings are realized, is actually on the medical side. So we're saying we need to invest in a system that has those medical cost savings and expand it to dental care. So that way, if the VA is paying for you to go to the emergency department, if you have medical coverage, and now we're paying $1,500 every single time you go to the emergency department, why not just take that money and invest it back in prevention so that we have coverage? And we're also saving veterans pain. We're saving them time because we're giving them the care that they need in the beginning instead of having to, instead of having to go to a system in a setting that's not working for them. And I think there's some real implications, too, about having the emergency department serve as the place where you get your dental care, because they're not going to have a dentist there. They're not going to be able to actually fix an infection or pain. They're not going to do anything with your teeth. They're probably going to give you a prescription for an opioid because it's a very painful condition. You know, when you're coming in with some sort of dental issue, they're probably going to give you an antibiotic. And you're probably going to be back there in 4 or 5 months if you can't get it fixed anyway. So a lot of times when we're not giving the basic care access, we could be facilitating these other issues that are painful, costly, and really detrimental.
So kind of emphasize that point again, because you talked about how dental health can affect like your other chronic diseases. So if a person needs to get surgery, could that be held up because they have some kind of dental problem that has to be addressed first?
It's interesting that you mentioned that, because the veterans that I've spoken with, that's oftentimes the only time that they'll get access to dental care. Is, perhaps they're going into the VA for a cancer treatment, and in order to get a cancer treatment, you go through a full body evaluation, for instance. I was just talking to a friend that this happened to his dad, and he was in so much pain because his dad, had to start chemotherapy and radiation, and he was covered through all of that through the VA. And so as part of starting that standard procedure, his dad came to the VA. They looked in his mouth and they said, well, you have some pretty significant issues here. And because his dad didn't qualify for dental care, he had really substantial issues. Teeth had to be pulled. I mean, he was in pain actually in his mouth, but didn't have a way to pay for it. And so prior to getting his cancer treatment, he had to have all of his teeth removed.
Wow.
And the VA gave him dentures.
Wow.
And what that meant was this man, if he had just been able to get dental care sooner, he could have started chemotherapy sooner because he didn't have to go through all of that pain right before then starting another painful treatment. And he may have had better outcomes. So unfortunately, what we see is that when people do interact with the VA before surgery or before some of these other medically necessary practices or treatments, they will get dental care, they'll get an evaluation, but because they haven't had care for so long, the effects at that point are irreversible. We've also found, talking about irreversible effects, we know that that veterans living in rural areas in particular have the worst oral health outcomes. They have the highest chronic disease conditions, and they are about 40% more likely to lose all of their natural teeth and instead use dentures. What we consider in oral health, we consider losing all of your natural teeth. It's a word called edentulous. We consider that to be the ultimate, negative oral health outcome. That means that there's nothing else that can be done because you're just relegated to having dentures at that point. And so what we continue to see, and what our data continues to tell us, and the story that we keep seeing from our data, is that far too many veterans are ending up there, not having any natural teeth at all, and just having dentures because they can't access dental care before that point.
Wow, imagine a world where dentures are kind of a thing of the past because people actually had access to dental care.
Right. Wouldn't that be wonderful if we could get ourselves there?
So why? So the medical community obviously has known this and talked about this and preached about this for many, many years. Why is it that in our policy that we haven't addressed dental and vision? Because in Medicare they don't really address it. They don't address it in the VA system, and yet we've been talking about this for many, many years. So what do you hope that this event will do that will change that?
Well, I'm hoping we see some movement on some bills. There's one bill right now that we're keeping an eye on called the VA Careers Act, and that would actually give several different, several different clinicians, including dental clinicians, support for going into the VA and getting licensure, and then going into the VA to actually expand and strengthen the current workforce. So that way, whenever we do expand access, that there is adequate workforce to accept that expansion. But we're also hoping to see more lawmakers paying attention, and if more bills are offered, we're there to say, okay, this is why it's important for you to pay attention to, and in particular, this is the cost savings that we're seeing. One thing I really want to impress upon people is, and I hear this a lot. I do a lot of advocacy. I was actually just at the Texas Capitol. I'm here in San Antonio, and I was just at the Texas Capitol this past week doing advocacy. And I hear so many times, does this matter? Are they listening? Are these lawmakers listening to us? Does it matter if we come and we tell them, and maybe we don't see movement this year or next year? And sometimes it can be really, really difficult to keep telling your story. But I want to encourage you that it does make a difference, and that these lawmakers really are paying attention. And it's a lot easier to pay attention whenever you're there, in front of them having these conversations. And what usually sticks with me are the stories of the veterans that I speak to, just like I shared right now about the veteran who got cancer. And, before he could even get any treatment, he had to get this really painful realization of removing all of his teeth because he just didn't have access to dental care before that. I was speaking to another veteran just a few months ago who had reached out to me after taking one of our surveys, and he had said, I'm just trying to get in to see a dentist. I do not qualify for dental care through the VA. We got him in to see, we got him actually enrolled into the VA-DIP program. He qualified for that dental care coverage. We connected him to an FQHC, and we worked on his case for a few months. And he wound up saying, after all of that, I'm still having to pay $1,000 out of pocket. And he said, I just feel so embarrassed at work. I feel like I can't even go to work. I have halitosis. I feel self-conscious around my family. And that's the kind of things that I don't think you can quantify in a number. It doesn't matter how much research we put out and how much we talk about the cost savings. When we go to the Capitol, we need veterans to say the real human impact of what's happening in their lives. When they're sharing things like, yeah, here's all the statistics and the numbers, and that's important, but this is actually how it affects me personally. This is my real life. Those are the things that those members can then go to their counterpart. They could talk about it on the House floor. Those are the things that they keep in the back of their mind when a vote comes on a bill, is saying exactly how that person is affected. And it winds up creating context around those numbers. It winds up creating context around those statistics.
So Hill Day is March 27th and March 28th. Is it open to anybody that wanted to go to that event? Can any veteran or person who cares about this go and speak their truth and say what's going on and hear what's going on?
Yeah, if you are local to D.C., I would say reach out to us immediately. We're going to be scheduling visits. We're going to be given lots of tools to figure out how to tell your story, how to coordinate there. We're really partnered with the VFW. We're so thrilled that they've offered their space for the day of the 28th to be able to have lunch and fellowship and network. And so they're right across from the Senate offices. And we encourage you, please come, please reach out to us. We'd love to get you the registration information. But also, if you can't come, you can't be in DC, or you're not local, that's okay, because on that same day, on the 28th, we're hosting a virtual day of action. So we will give you some email templates if you're willing to send an email to your member of Congress and say this is why it's important. We're also holding some trainings before that event. You can get all of that information on our website, www.aidph.org. So we're going to prep you on the policy ask. We're going to prep you on why this is important. And also, we're going to give you some ideas about how to tell your story so that if you can't participate in person, that's okay. Your story is still going to be heard. We're going to give you the tools to be able to email your story to your members of Congress, and also just be visible on social media. We're going to be sharing hashtags, and we're going to be sharing social graphics, and there's lots of ways to make your voice heard, because all of it really does make a difference. Again, I know that sometimes it can be hard to determine, but every single time you make a point of contact with your legislator, that staff member is tallying every time they hear, man, I heard somebody say dental care to me 50 times today. I've never gotten this many emails before. That's actually a metric. They measure how many times they receive emails, how many times they receive phone calls, and sometimes the threshold could be as little as 3. Wow. You call 3 people call in one day, that means it's going to their boss. And so I want to really impress upon you that even if you're not there in person, you're making a difference. 3 emails in a day, all it takes is 3 emails for them to say, okay, I need to talk to my boss about this. So we're going to give you all the tools that we can find to stay visible, to stay active, and to help everybody talk about this across the nation.
And I think you mentioned this so many times in our show, but it's so important because it improves the lives of people. It improves the lives of veterans. So many positive things can come out of this, because now you have if you do this at the VA level, now you have a model that can be used at the national level. This is something that could be transported and maybe even implemented with Medicare. And the bigger point is this, as you mentioned, there's data and research that's real from all kinds of different sources, credible sources, that show you this saves money. Saves lives and saves money.
Absolutely. And we'd be willing to work with any local entity, whether that be state-based Medicaid or, even talking about options in Medicare, to show how this is both saving veterans money, saving taxpayers money, and ultimately improving our health and well-being across the board.
So what's the last thing you want to tell us? We have about 1 minute left. Make your pitch to the audience, let them know what's going on, how important this day is. We want to get as many people out there to participate.
You know what? If I were to leave you with one thing today, I want to leave you with the 85% statistic, because I think that's the most important one, which is, 85% of veterans who are already getting their medical care through the VA don't qualify for dental care. So we're talking about an enormous wasted opportunity, knowing that veterans are going in, they're getting their medical care, and that they're really satisfied by that care, but they just can't get their dental care. And so for us to change that 85% number, it takes 2 things. It takes changing the federal code through a bill, and every single one of you has the ability to influence that. And then number 2, it takes asking for some money behind the scenes. And as we've mentioned, our research actually indicates cost savings. And so there are some positive budget implications here after we changed the federal code of actually saving dollars after that expansion. So I hope if you have the time to join us on the 28th virtually, that you'll be able to do that at www.aidph.org.
Reach out to AIDPH. This is Dr. Annaliese Cothron. She is the co-founder and executive director of the American Institute of Dental Public Health. Thanks for your time.
Thank you.
This is America's Heroes Group. We'll be right back.
Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Quaker Drive, Suite 4250, Chicago, Illinois, 60606. Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Quaker Drive, Suite 4250, Chicago, Illinois, 60606. Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Quaker Drive, Suite 4250, Chicago, Illinois, 60606.
Welcome back to America's Heroes Group with our roundtable community outreach with the Illinois Army National Guard. Today is Saturday, February 18th, 2023. February is Black History and American Heart Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a panelist with us, an historic event today. This is Major General Rodney C. Boyd. He is the Assistant Adjutant Major General for the Illinois Army National Guard, the Supervisor of Management of the Illinois Department of Military Affairs, and a Chicago native. He is the highest-ranking person of color in the Illinois National Guard's 300-year history. And we're going to talk about the Adjutant General and all matters around the supervision and management of the Illinois Department of Military Affairs and the Illinois Army National Guard. To give you some brief background on our distinguished gentleman for today, he has a 41-year career, started as a Marine. He now serves as a Principal Assistant to the Adjutant General in all matters pertaining to supervision and management of the Illinois National Guard, managing about 10,000 citizen soldiers, served in Iraq and Afghanistan, Bachelor in Criminology, Master in Education, also a Master's in Strategic Studies from the U.S. Army of War College. His 23-year career in law enforcement saw him rise to the rank of Chief of Police for the city of Bellwood, Illinois. After law enforcement, briefly served as a Vice President of Operations at J.P. Morgan Chase Bank, and also a Supervisory Criminal Investigator for the Northwest University Police Department. Husband, father, grandfather, welcome to our show.
Thank you. Glad to be a part of it.
Glad to have you, and it's an honor and a privilege to have this conversation with you, sir. Can you hear us? Hello?
Yes, thank you. I'm here. Yes, thank you.
Yeah, I just want to give you basically your due respect. So, Major General, tell us about what you do, and also give us a background on what the importance is of your job.
Okay, so you kind of mentioned it briefly in your introduction. So, the Illinois National Guard consists of the Army Guard and the Air Guard. Mm-hmm. Currently, in the Army Guard, we have approximately 10,200 soldiers, a little bit more than that. And in the Air Guard, we have another 3,100 soldiers. So I'm responsible for the 10,200 Army Guard soldiers in all matters pertaining to the Army Guard. So that's anything from training, equipping, health, making sure they're good to go for any missions we have to serve both on the homeland and abroad.
So as an Army National Guard veteran myself, a lot of people don't realize that the Army National Guard is part of the U.S. Army. And also yes. The Air National Guard is part of the U.S. Air Force. How important is that as far as the strength of the overall Army itself? And kind of give us a little bit of people that don't really know, a little bit of background. People that have kids that are going to join the National Guard, to think they're not in the Army. They think they're just going to go and do like some kind of reserve training, whatever, and they're not going to ever get activated. What is some of the responsibilities of the Army National Guard?
Well, so not too long ago, the Army National Guard and the Air National Guard, we were considered a strategic reserve, which basically meant that, we had minimum amount of training standards to meet, and that we were just on call in event something big happened in the world and active duty Army needed some assistance. But that all changed with the Middle East war. And what active duty Army realized was that they couldn't fight that war without the help of the Guard and Reserves. So as we fought alongside our active duty brothers and sisters, we transitioned from a strategic reserve to an operational force. So basically that means that we have to be ready on a moment's notice to be able to serve abroad alongside our active duty brothers and sisters. So for someone that's contemplating joining the National Guard, I always would recommend that they understand that our requirements are a little bit higher than what they used to be, and that we are to be ready. Our first and foremost responsibility is to fight and win our nation's war. That's even before our homeland mission. So if you're going to join, we're a different National Guard than we were when I first enlisted over 35 years ago. But it's a good thing, because with that comes a lot of responsibility and a lot of opportunities to fight alongside our active duty brothers and sisters and show that we can win our nation's war when our nation calls us.
I think that's really profound that you mentioned that, because it is, I think the National Guard and the reserves as well play an integral role in the overall strength and health of the United States Army and the military itself. When you first joined the military, you joined as a Marine reservist. What was the transition like going from the Marines to the Army or to the National Guard, and what made you make that change?
Great. So I was an enlisted member while I was in the Marines. So I had enlisted for 6 years, 6x2 of 6 years active, and 2 years my name on a list that I can be called up at any time. So after I completed my initial contract, I was at the rank of E5, and I had a good friend of mine, not only a good friend but former college roommate and frat brother, who said, "Hey, Rod, what are you doing now that you're done with the Marines?" And I was like, "I'm doing nothing. I served my country honorably. I'm calling it quits." Long story short, he convinced me. He saw more in me than I saw in myself. He said, "We can use someone like you over in the Guard as an officer in the Guard." Because at the time I had completed my bachelor's degree. He said, "You already have your bachelor's degree. You can come over here. We have a part-time officer candidate school program. And you can come over here, you can be an officer in the Guard and have a great career." And based on that conversation, I took his advice, and that what sparked my interest in moving over to the Guards for the Marines. And I never looked back ever since that conversation.
What are some of the things you learned in the Guard, particularly when your deployments? Because when you first got deployed overseas, how did that change your life, and also how did you grow and develop out of those experiences?
Yeah, so my first deployment, I worked with some of my NATO allies, every day, and so that gave me a perspective of what it is to work with other countries that share the same interests, and that was the security and protection of each nation that we represented. And so, for the first time in my life, I experienced life outside of Illinois per se, and life and I learned the importance of what national security meant, not only to the United States but to our coalition partners. And that within itself, I grew as an individual. That was the first time I really realized how important national security was. And that just helped me grow as an individual.
So how important is national security? Because when we think about national security, oftentimes, particularly when politicians use that word, I think some of us think it's used too much and people don't really understand what that really means. That everything becomes a national security issue when you watch the news and things like that. What is national security really about? So
again, as I look at, I've been blessed that as you mentioned in the introduction, I was in law enforcement for 23 years. So you think about, national security on a larger scale than law enforcement. Law enforcement, your local law enforcement is responsible for the safety and the protection of the citizens of that particular community. So without the basic law enforcement, you cannot move around in your community and do the things that we just take for granted. Same thing at the national level. The national security is basically protecting our borders of our nation so that we can move around freely, things that we take advantage of every day, but we're able to do it because we have such a strong national defense. So that's the importance of national defense. If you think about what's happening in Ukraine right now. Mm-hmm. They don't have they're fighting for their national defense because they have someone trying to encroach their borders. And in some cases they have already, but they're trying to fight back because they just want to enjoy the simple things in life that many of us take granted every day. So that's how important national security is.
And then when you were working in law enforcement, you became the chief of police for the city of Bellwood here in Illinois. What experiences did you bring from your military career that really helped you excel at that position?
Well, so what I brought to that position was that at that point in my life, I had excelled to I had completed a battalion command, which is I was in charge of some close to 1,000 soldiers, and then so running a department of 50 sworn personnel was a little bit easier than commanding a battalion of 1,000 soldiers. So what I brought to that table is, when I assumed that role, was that I made every member of my staff feel that they're part of the team, and that their ideals matter, and that I would take their ideals into consideration in shaping that department for the future. And so that is something that I learned as an officer and as a leader in the Guard, and it just helped me when I transitioned to that position as chief of police.
So what advice would you give to police chiefs around the country? Because from living in Illinois and moving through Maywood and Bellwood and those areas, Maywood and Bellwood, particularly when you were there, seemed like everything was under control. Like you mentioned before, the ability to move freely through the community. And I always felt that was the case, during the time when you were in that police force. So what would you advise people who are in the position that you were in to be successful at their job, particularly with all the controversy today with police shootings and people that are not satisfied with how they're being treated by the police and still the rampant crime that exists in a lot of communities?
So at the end of the day, an individual that puts on that uniform have to believe that they're there for that particular community that they work in. And if you believe that, you're gonna provide that community that level of service that they deserve. And that's one thing I always enjoyed about work for Bellwood. We've always, during my time, I can only speak about during my time, we've always championed the thought that we are here to serve the community, and that the best way to do that is to get out there every day and make sure that the community can move about freely and can go to work 8 hours a day and come back home without worrying about their door being kicked in and somebody stealing items from their home. That's what it's about. And just having a relationship with the community, having things that bring the community and the police together. And so if we can get back to that, I think that's the basis for at least establishing that there is an adversarial relationship between police and community. It's a togetherness that can coexist.
So, Major General, tell us about when you were deployed again. So when you got deployed, what advice would you give to service members today who have never been deployed? How do they psychologically prepare themselves for deployment when they feel that it could be extended, particularly? We're talking maybe a couple of years, 2 or 3 years, maybe longer.
So the good news is that they've got it down to the second. They know it's a very stressful position to be deployed. So they got it down to a science where unless you volunteer, you're only going to serve deployed for 1 year, right? Unlike back in the day when it was World War II, you could serve 2 or 3 years away and, you'd be gone for that period. But now, because of the Army has really come full circle, it's good. At the most, it's a year in deployment. So that's a good thing. But how do you prepare? So I've always said, and I tell my soldiers this to today, because I am still responsible for sending troops overseas for assignments, but they're not at the numbers that it was at the height of the Middle Eastern war. But there are still some units soldiers going out the door and serving overseas. But anyway, so what I always tell soldiers, every now and then you get an opportunity to do something great for your country, something that you have prepared for all your life. This is the opportunity. Now go and show that you're ready to do this particular assignment. Stay safe and come back. So have confidence. I tell soldiers, have confidence in your ability, because that's what you've been training on your entire time in this military. So now you get an opportunity to demonstrate that you understand your job and that you can effectively do it in a stressful environment. So the bottom line is, I tell my soldiers to have confidence in your ability that you're already proven that you have.
I think that's great advice. Excuse me. So, Major General, so when you look at what's happening in the city today, and particularly the fact that over the last 20 years or so, Black men have not been joining the military in the numbers that once were. Do you see that you've had tremendous success and benefited tremendously from your experience in the military? Do you see that opportunity? What would you say to Black men today who maybe are looking for direction, need some direction, maybe don't have a lot of opportunities in their community? How would you advise them that the military is still a place where they can find opportunity and do something with their lives, productive, and go to places that maybe they never even dreamed of?
Yeah. So I would advise them to listen. Go seek a recruiter, right? Go sit down and talk to a recruiter, and because I believe part of the problem is they don't really understand the value of being a member of the military and how much it can make their lives that much better and provide more opportunities. But you don't know what you don't know. And so one of the things that I've been doing since I've assumed my role almost 19 months ago is I'm out here. I'm trying to attend as many events as possible that I can interact with young people and to let them know the advantages and the opportunities that the military can offer, and the advantage particularly of the National Guard. The National Guard and the Reserves, but I'm biased toward the National Guard, obviously. You can serve your country and still live in your community and get all the benefits that comes with that without ever leaving your community. How great is that?
Mm-hmm.
And I think
tuition paid.
Go ahead. I'm sorry.
100% tuition paid. Sorry to interrupt you, General, but 100% tuition paid and for any state school, and that's pretty much across any state Guard program, whether Air Guard, Army Guard.
Yeah, and we're not just talking about the bachelor's degree. You can get up to a PhD or a JD. You can get several degrees. Not only just tuition, but you have health insurance, you have retirement benefits. It's just so many other options or opportunities. And how about this? The basic: you learn a trade. You learn how to do something that the government is paying for you to learn, free to you. A skill set that you'll keep for the rest of your life. How great is that?
Mm-hmm. So, Major General, where do you want to see the National Guard go, particularly the Illinois National Guard? What is your vision for our forces for the next, say, 5 to 10 years? What do you want to see us progress to and evolve into?
So what I'm seeing now, and we're starting this, and we have some great traction. A force that feels inclusive to everyone. right? Yeah, I have to be honest with you. When I started some 30-some years ago, it wasn't a very inclusive force, but I'm proud to say that we are working on being a very inclusive force for everyone. We want everyone to put on that uniform and serve in our organization, feel that they belong, because they do. The minute you qualify to join our ranks and you raise your hand, you take that oath, you belong. And it's up to us as leaders in our organization to make everyone feel that they belong. And so we have a great team of leaders that's working on making every soldier that put on a uniform, stand in our formation, feel that they belong, and that they will have an opportunity in our organization.
Well said. So any final thoughts?
It's just the Illinois National Guard and to include, and then my experience in the reserves have really afforded me an opportunity that I never would have thought of, growing up on the south side of Chicago in public housing, on public assistance. Life for me, it didn't seem like it had a lot of options. But I'm here, and I'm proud to say that because I stumbled onto the military, because it wasn't introduced to me. I don't know why. I just didn't really hear much about the military. But somehow I was able to stumble onto the military, and it has afforded me so many opportunities. As you mentioned, I deployed 3 times. In addition to deploying 3 times, I've been to about 5 other countries that on training missions that I never would have gone to hadn't been for the military. So I'm going to spend this next chapter of my life in this position, hitting the pavement, spreading the word that we are an organization, the Illinois National Guard. We are an organization that can afford you an opportunity. And this is coming from a kid, again, from the south side of Chicago, raised in public housing, on public assistance, and a CPS product. I'm telling you, you can do it if you just listen and take a chance on yourself. Bet on yourself, and you can have a great life out here.
Great words. Major General Roddy C. Boyd, Assistant Adjutant, Major General for the Illinois Army National Guard. Thank you for your time, sir.
Thank you for having me.
This is America's Heroes Group. We'll be right back.
Hi, this is Cliff Kelley, Vietnam veteran, co-founder, and host of America's Heroes Group. We have helped hundreds and thousands of veterans find the resources they needed to move on past trauma, find the services they need to heal, find training, jobs, and housing. That's our mission. To support this mission so that we can continue our work and have even more veteran stories of overcoming and success, we need your help. Right now, please consider making a donation to America's Heroes Group. Dig deep and give what you can to support this mission and help those veterans in need. You can donate through Chase Bank's Zelle app by adding America's Heroes Group as a recipient with our phone number 312-804-5831. You can donate through PayPal on our website, americashg.org. From the home page, go to donations, or you can go straight to www.americashg.org/donations. And finally, you can send a check to America's Heroes Group, Inc., 155 North Quaker Drive, Suite 4250, Chicago, Illinois, 60606.
Welcome back to America's Heroes Group, this time with our roundtable and our partner, the National Nurses United. Today is Saturday, February 18th, 2023. February is Black History and American Heart Month. Our host is Kelley. I'm Sean Claiborne, the co-host, Army National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have our panelist on the line, Cecilia Sherrod. She is a nurse recruiter, and she's going to talk about how hiring associate degree nurses will help the VA's nursing shortage. So what's going on, Cecilia? How you feeling?
I'm feeling great. Thank you for having me once again.
My pleasure.
And this is a great topic. I'm going to tell you why. The VA, vision-wide, is now pushing for the VAs to now hire associate degree nurses. What we've seen...
Well, first back a little bit. Tell us the difference, because I don't know anything about the different trainings of different nursing degrees and so on. So what's the difference between an associate, like what are the levels of nurses?
Okay.
First off.
So let's start with the levels. You can have an associate degree nurse, which is a 1-year nurse. You can go to school for 1 year and have obtain an associate degree. The bachelor's degree nurse is the next one, which is a 2-year degree. Then after your 2 years, you can do another 2 years and get your MSN degree, which is your master's degree. Then there's also another degree after that, which is your DNP, your doctorate or your PhD. So there's actually 4 degrees within nursing. So it's your associate's, your bachelor's, your master's, and your doctorate's degree, or your PhD if you want to do that. You can have accelerated schools, accredited schools, where you can go from your ADN, which is your associate degree, and do like a 3-year and get your master's degree. So they do have accelerated courses or schools where you can skip over that bachelor's degree and obtain your master's degree. And most nurses are actually doing this. So most of the nurses that are coming out are obtaining their master's degree or their bachelor's degree.
And that's 4 years? Did I get that right?
Yeah.
For a master's? Okay. So it's a little bit different than what you normally would do if you did a regular, like, bachelor's. The normal bachelor's would be like 4 years, so it should be 2 years. It's like half, just if you're going to specialize in nursing.
Correct.
Okay. So tell us more about how hiring associate degree nurses will help the VA nursing shortage, because what are the concerns about it, and why haven't we done this already?
So I don't think there's any concerns about hiring associate degree nurses. I think what it is many associate degree nurses either don't apply, they go straight to the nursing homes and try to get up their skills. But again, I don't think there's any backlash to it. The reason why the VA is now pushing for this, and as a nurse recruiter, they're even pushing us to now bring in more associate degree nurses. So here's why. Within the next 5 to 10 years, we will see a huge retirement of nurses throughout the VA. The average age of our nurses, they're already in their 50s and 60s, believe it or not. They've worked well past, their retirement age, a lot of them, just due to the cost of living, and they may be the only breadwinner in their homes. So they've kept working. But in the next 5 to 10 years, we do see a huge retirement factor coming. So this is why we're now pushing to hire the associate degree nurses within the VA systems. And they're young, they have staying power. They're not coming with any bad habits where, after a nurse has been a nurse 5, 10, 15 years, they've created all these bad habits that you have to kind of dig into and wash away. And they can we can mold them basically to, I don't want to say how we want to mold them, but basically teach them and have them maneuver through the system. If anybody worked through the VA system, they know what I mean.
Mm-hmm.
So in other words,
learn like the VA system versus learning a civilian system. Just like if
correct.
you're going to be in the military, you learn if you're coming from another world and you've been working several years doing one thing, the military world will seem foreign to you completely. But if you're growing up being trained in that, you're already ready for it. So that's what you know, that's what you do.
Correct.
So now tell me
Correct.
this, though. But tell me this. So so is there? We talked about this before when you came on the show about pay. Pay was a big issue because someone could get more money doing something else with their qualifications. So with how does that work with associate degree nurses?
So with associate degree nurses, the VA system, at least where we are, I can't speak to others, we have pushed and we've gotten that 4.6 increase in pay.
Wow.
So, of course, if you're coming in with an associate degree, you're not going to make as much as someone with a bachelor's degree or a master's degree who has 5 or 10 years. But what we also tell, nurses that are coming on board, what I tell them is you got to outweigh the pros and cons. So do you want to make money right now, or do you want to get the experience, get the exposure, get all the benefits that come with being a federal employee? And basically, what we also have is what's called the NNEI Scholarship, the National Nurses Initiative Scholarship. And what this does is it pays that ADN if she wants him or she wants to go back and get their bachelor's degree or their master's degree. Once they're there for 1 year, they will pay for their next degree. So again, I tell them, weigh the pros and cons of, do I want to make money right now and that's all I'm making? Or do I want the other benefits that come with working within the VA system?
So it sounds like there's more long-term benefits from getting that initial training in a VA system.
Correct.
Okay.
So, yes, they can make the money if they stay on the outside right away, but that's all you're getting is the money. Long term, that money will come as you climb up the career ladder, as you go from that nurse 1, that ADN nurse, to now a nurse 2, the BSN nurse, to now the nurse 3, the MSN nurse. And as you move up the career ladder, you do start to make more money.
It seems like just off the bat, if you're going to get 1 year of training for free and get your degree for free just after doing service for 1 year, then I would think, when I was in the military, I was in a medical company. So a lot of the people that were in the unit were paramedics. They were assistant surgeons. They were all kinds of things. Dr. Arnold was in our unit, actually. So when we were getting trained, I was a mechanic. I wasn't the medical side, but I saw a lot of what the guys were doing. I saw that a lot of people were using the military as leverage to get the training and experience, and then it made it easier for them to get their training because they saw how to do triage, they saw how to do things in their military training, and getting hands-on experience at the same time. Then it helped them excel really in their schooling at home.
Mm-hmm. And it's funny you say that because with Lovell, the facility I work at, we've actually merged with the Navy. And what I can tell you, I've been working with the Navy now for, I want to say, almost 10 years, is they really set their individuals, those young men and women, they truly set them up well. They give them the experience and the exposure they need. They give them the resources. And I think this is what we're trying to do now, for these young nurses, is you may not get the money up front, but look at the long-term experience you will get. Look at the long-term benefits you will get in working for a VA system.
So, and this is more purely your personal opinion, I'm asking. But would you say that aside from the money, are the benefits on the federal side better than what you normally see in a typical hospital? And a part of that is I'm asking this because I've noticed it, and I've heard this from a lot of civilian nurses, that there's a lot of turnover in the private sector. Nurses unhappy where they're working, they're going to different hospitals or changing places. The average civilian nurse I know has been to at least 2 or 3 hospitals, but the average VA nurse, I don't know they've ever done anything. That's what seems like that's all they do. They stay with the VA. So let me ask you this: are the benefits better?
Yes, the benefits they're so much better. And I'm going to give you an example because we had a nurse that just retired that had been there for 50 years. So she started as a CNA, went back to school, got her licensed practical nurse, which is an LPN, got a job there as an LPN, went back, got her RN degree, got a job as an RN, went back and got her BSN, then her master's degree, got a job as a nurse manager there, became the associate chief nurse, which she just kept climbing the ladder till she was actually the chief nurse of the facility.
Wow.
And she retired after 50 years.
Wow.
So the health benefits are great, federal health benefits. Again, we're paying for your schooling if you want to go back and get a higher degree, your BSN or your MSN or your DNP. And as you're moving and you're getting these higher degrees, like I said, you are making more money. You can go from a nurse manager to associate chief nurse. There's so many opportunities. And let's just say you move or life happens and your husband, gets another job or wife gets another job. You do not have to leave the VA system. You can literally transfer to another VA in another state. A lot of people can't do that in the outside sector. Once you move to another state, you have to find a whole new job. In the VA system, you can literally transfer to another VA. Then there are the unions, really, that help guide the nurses. People look at unions and they frown on them. But as a union member, we really advocate for the nurses, telling you and coaching you, and we're truly a resource to our nurses, saying these are the options, this is what's out there for you. Because when you come to the VA, just like you said, it's a whole nother world. I'm telling you, my first year, I thought I was in a twilight zone. It was so different from the outside sector.
Well, tell us more about that just for a brief moment. So when you say it was like the twilight zone, so did you look down upon what you saw in the VA, or it's just different?
It's just different because if I was to go from another hospital to another hospital in the outside sector, it's pretty much set up the same. When you go into the VA world, the charting is different. The dynamics are different. When you're dealing with just veterans or their family members, so that's different. The structure is different, and what I mean by the structure, just the language, the lingo was different. When we say work day on the outside, it's a tour of duty when you're in the VA system. I had no idea when they kept saying tour of duty. Like, what are you talking about?
I'm thinking
but that just means your work day. Right. So that's what I mean by it's just so different.
Yes, that's so. Do you see this move to hire more associate degree nurses as a solution to the nursing shortage in the VA?
I do, and this is the reason why. Like I said, within the next 5 or 10 years, our nurses will be retiring out of the VA. We need someone, the younger generation, to pull up the rear. We cannot keep bringing in 40, 50-year-old nurses because, again, they're only going to give us another 10 years, and then they've retired. So if we start bringing in the young nurses in their 20s, early 30s, then, like I said, they have staying power. They can be there for another 20 years.
Now, when you go and recruit nurses, where do you recruit nurses, and how do you go about it?
So when we recruit, we really start at the schools, the colleges, universities, and we start really at the sophomore level, sophomore and juniors. We start talking to them there, and we start giving them these options. This is why you should work for the VA. These are the benefits. These are the pros and cons. So it's mainly in the schools.
I would think that the VA system, because a lot of people might be daunted, because I've seen and heard horror stories of young students going into medical programs where they didn't get the proper training, mainly because they didn't have the financial resources to get the real training. So they went to for-profit schools, were insufficiently trained, and then now they can't get a real job because they don't have the proper training and education. Whereas through the VA system, it sounds like you're going to make sure they get the right education.
Absolutely. So what the VA has also instituted is what's called the RNTTP, and this stands for RN Transition to Practice Program. So as the new nurses are coming in, it is mandatory that they go into this program for 1 year. And they are set up with a mentor, they are set up with a preceptor, and they are checked on weekly as to how are things going. So, again, when we hire these young men and women in, we're not just going to let them loose in the facility. We will lose them quickly. They have to. They must. They are mandated to go into the RN transition to practice program.
So what are some of the ways that people can get financial assistance to get their initial training?
Initial training for?
To become a nurse, just to get an associate's degree. So because that's one of the things that a lot of people that try to get training for, they can't get the financial resources together to get a degree.
Right. So in the VA system, let's just say I'm a CNA or a healthcare tech or pharmacist. What we have is called, it's EISP. And what this is it's a program. It's called the Employee Incentive Scholarship Program, EISP. So let's just say I'm a CNA or a healthcare tech, and I want to go back for nursing. So I apply for this program. I'm accepted. And this program is actually, it helps the employee go back to school or training to pursue a higher degree. So if you want to get your ADN or your BSN.
What about the initial training? I'm just talking about like someone who's a high school student who graduates. They know that nurses make a lot of money. They think they're qualified to do it. They have the acumen as far as the mental and emotional requirements to do it. It's something that they care about or passionate about. Where do they start to get the resources to go to school to get an associate's degree?
So what I would tell them is to basically reach out to a school, whatever school, first pick an accredited school. So this has been a huge issue too. Mm-hmm. We have found out some of these nurses who are going to school have not went to accredited school, and now they are having issues with their license being in jeopardy. Mm-hmm. So the first thing I would say is have these young men and women find an accredited school that they want to go to. From there, they can apply for a student loan, and there's multiple student loans that they can apply for. And it's not a loan. They can also apply for what's called a Pell Grant. Pell Grant will pay the school for you. So first, find an accredited school. Then apply for a loan or a grant.
Wow, so that gives you kind of the blueprint right there. So if they go to an accredited school,
Yeah.
separate those guys out first, like we mentioned before. Because there was a huge problem. Just a few years back, we talked about it on this show. Did a report on the fact that a lot of for-profit schools are losing VA funding or losing GI Bill funding because of the fact
Correct.
that they weren't meeting the basic requirements to help people get jobs. Kids were going into $30,000, $40,000 in debt and coming out,
Correct.
Not even barely trained to do anything, even in a nursing home. Because they had no clue that they were what they were learning, but they were not qualified.
Exactly.
So you can get a Pell Grant, get on financial aid at an accredited school.
Correct.
And they can reach out to National Nurses United, I'm assuming, to get maybe some guidance on to what those schools are, or where those schools are.
Absolutely. And I can even say, if they are interested, even joining or applying for a VA, they can also reach out to the nurse recruiter within their area, the VA in their area, and that nurse recruiter will also help guide them through the process.
So that's the blueprint. I mean, reach out to a school. I mean, what type of money are we talking about for a VA associate degree nurse? Starting salary, what are we talking about?
Right. It depends on the school. Colleges, you can probably get an ADN for maybe $10,000, $12,000. If you go to a university, universities are much more. It can cost maybe $15,000 to $20,000. So it really depends on the school.
But how much money can they make once they get their degree? Say they go into the VA and now they're hired as a nurse, as a nurse working in the VA. They're in that transition program that you mentioned before, the 1-year program. How much money are they going to make in a year?
So in a year, you can come out making about $90,000.
What?
80? Yeah.
90,000?
80 to 90,000. Yes.
Starting out.
Again, remember I just told you. Yeah.
So you've been to school for 1 year.
Again, I can only quote in my area, the area of Wisconsin and Illinois. Yeah, you can come out making 80 to 90,000. Yes, easily.
Why isn't like every person who is lost and dazed and confused, wandering around the halls of a high school, not thinking about doing exactly what we just gave you the blueprint for success.
Mm-hmm.
We just laid it out.
Mm-hmm. You know why? Because no one is there teaching them that. They don't have that exposure. No one is saying, this is an area. There is a need. This is how much money you can make. And it's not about the money. You have to love the job.
Or something like that.
Right.
You got people that have been in college for 8 years and they're making $40,000, $50,000 a year.
Oh, no. Our nurses right now, if I tell you, oh, my God, our nurses are making, the highest nurse is making about $180.
Wow, that is crazy.
Mm-hmm.
That's crazy money.
That's doctor's money, is it
That's
not?
Wall
That's
Street
physician's money.
Man.
So, yes. And go ahead.
No. It's just a comment. That's just phenomenal. So, we got about 30 seconds left to kind of give us the one thing you want us to know about this initiative to get the associate degree nurses in the VA system.
The one thing I do want to stress, if there are associate degree nurses out there and wanting to get into the VA system, please reach out to your local VA and speak with the nurse recruiter. That will be your best bet. Like I said, they can navigate you through the process of how to get into the VA, how to get into different programs, and how to maneuver through the system. So reach out to your local nurse recruiter.
Cecilia Sherrod, it was a pleasure to have you.
Okay. Thank you, sir.
My pleasure.
Okay, bye. Thank you.
That's our partner, National Nurses United. Bravo for nurses, because without nurses, without nurses, you have no hospital.
That's
so bravo. 4 great shows today with our partners, Hines VA, bravo. American Institute of Dental Public Health. Great show, all great shows. Illinois Army National Guard. Major General Boyd. Bravo, Black History Month. Yes, so proud of him. Thank you all for always listening and watching us live. Facebook, YouTube, podcast, America's Heroes. We're global because of you. Go to our website. You can always go back and look at other shows. If you missed information or wanted to get more information regarding resources and information you thought you missed, our podcast. So go back and review if as needed. Excuse me. The Honorable U.S. Representative Danny K. Davis, 7th District of Illinois, invites you to join him and other special guests at a town hall meeting that is needed. You need to come and hear legislative reports on what's being done and said in D.C. so you stay connected and engaged to the latest developments regarding you, the constituents. And he wants to have a feedback conversation with you regarding what you're thinking about what's going on. So please, in remembrance of the community sheroes and heroes for Black History Month, it is Sunday, February 19th, 2023, from 3 to 5 p.m. at Home of Life Missionary Baptist Church. More information that's needed, please call Miss Josie Ware at 773-533-7520. Please join Congressman Damidatis, February 19th. Feel free to call America's Heroes Group regarding your issues and concerns about affordable housing and other topics and subject matters that's discussed on America's Heroes Group. This show is for you. It's the platform for you to give your voice to power. You speak your truth to power. Please, you can always feel free to call us at 312-803-2618. We're located at 155 North Wacker Drive, Suite 4250, Chicago, Illinois. Please feel free to call us. Sean, I want to briefly make a comment regarding CNN morning show with Don Lemon and his other co-hosts regarding the fact that they were articulating Nikki Haley's comment about being too old to run for an elected office. So I personally disagree with her, because as a woman, we just recently, how many years ago, got the right to vote. Mm-hmm. So I feel if you're going to run for an office, let it be about your platform. Don't use other people, you negatives, or you think their weaknesses against them, them to prop you up. So I don't appreciate her saying that about President Biden or Trump. No, because to me, age, race, gender, and religion discrimination anywhere is age, race, gender, religion discrimination everywhere. So indirectly, she's discriminating against both of them.
Definitely.
Yes.
Most definitely.
Our technical producer, Mrs. Kaya. Yes, girl, you keep us balanced every week until the best digital media producer America's Heroes Group has ever had. Ivan Ortega of Scott's Earner Production. We highly recommend his services to anyone trying to move into the digital live streaming program platform. The man is about excellence. On behalf of all of us, Cliff Kelley, Dr. Arnold, Sean Claiborne, please have a blessed and wonderful holiday. Yes, it is a holiday weekend.
President's Day, yeah.
Yes, it is. So yes, you guys, yes. It's America's Heroes Group. We connect the disconnected intentionally.
Love you guys.
Blessings.